this morning, and it was kind of like she didn't really. I mean, I'm sorry, not the nurse. Dr. Mulroy called me,
Okay.
and I didn't really understand exactly what it was. She didn't tell me what her oxygen level was. She just told me that her situation was, starting to decline. And I don't know exactly what she meant by that, because she was just asking for like the third or fourth time asking like permission if she could be incubated, and I don't know why they started asking me about that like 2 weeks like a while ago. I don't know why they've been asking about it so much.
Well, we like to have our game plan for what's going to happen to a patient, because the last thing we want to do is do something that would be against the family's wishes.
Yeah.
Or if something happens in the middle of the night and we're trying to get a hold of somebody, we can't get a hold of somebody. So that's pretty typical for any hospital admission, that you would try to find out if somebody has advance directive, or if they're DNR, or what they would like us to do. That's pretty common, especially when you get to an ICU level. They want to know what the family's wishes will be if so and so happens. When I was a bedside nurse, I would always ask my patients, even if they were walkie-talkie, totally healthy, I knew they were going to go home. Heaven forbid something happens, what would you like me to do? What would be your game plan? Do you want CPR? Do you want to be intubated? Just so that we have a game plan and we're all on the same page. So if something happens, time is everything. We want to be able to know ahead of time, so if something happens, then we can go to it. Also, in your mom's situation, if things are progressing, sometimes people feel one way, and then as the care progresses, then they change their minds, which is totally fine. So we just like to make sure we're still checking in, that nothing has changed in their mindset on what they would like us to do, so that we are, on the same page with the family and ready to do whatever needs to be done.
Right. So, I said you were going to review the situation. I guess you'll check on it, right?
So I can go upstairs and check in your mom right now and come back down and give you an update. In terms of some of the other complaints or things you've had, I would need kind of some a little more specifics on if you know dates or times, or even nurses, even dates and nurses. I mean, obviously, if there's dates and times, then I can look and see who was assigned to her at that point.
Yeah, I can check all that.
And then we can follow up with that.
Yeah.
We would be more than happy to follow up on any issues you feel that have happened, or kind of complaints you have. We'd be more than willing to follow up on that, because we do want you to be comfortable with what the care that we're providing. But like I said, I would just need to know a little more specific time, so I would know what nurse to go to, or house super, whoever to go to, so I could kind of get their side and see where they were at when things were happening, and decisions that were going down.
Yeah. So. Okay. I don't understand why she wasn't. I don't know. It just doesn't make sense why on the fourth day, when she was doing better, she got admitted. It was it was the middle of the night. It would have been the 18th, early in the morning. It was the 17th the insurance called here for her, and they should have started the check-in process for her name. And he said they would have if we needed, they'd have a wheelchair out here. But it took us a few hours because she didn't want to, unless we had to call the ambulance. She wanted to keep moving around. So I took her downstairs, got her in the car and everything, brought her over here, and came out and got the wheelchair and stuff. And it was probably, I can check my phone, all the records on Verizon, but it was early in the morning, probably past 1 a.m.
I mean, like I say, to know for sure exactly.
And on the 19th, the situation improved. During the 18th, the situation was slightly improved. The 18th, it improved. And then the 19th, it improved. And it would have definitely been, I can check the phone records, the 19th or the 20th.
Okay. And like I say, it's hard to tell you exactly 100% what was going on without looking in her chart to see, because it can be it can look like, her numbers are looking good, but then again, if her numbers are looking good, but we were steadily going up on oxygen, but her chest X-ray was looking worse, but she was super anxious, but she was breathing too fast, or if you breathe quick, your heart rate goes up. So if there's all these things happening that we're trying to.
I kept asking about the chest X-rays, and they said after a whole week, they're just we don't. That's not how we check for COVID to see if it's getting better. We just check oxygen levels.
Well, there's a lot of things that go into it. I mean, you can look at oxygenation, you can look at, there's labs, there's chest X-rays, other kind of medications. It's not just one thing you look at.
Yeah.
and you have to look at the whole picture. You can't, I mean, you can't just pick and say, well, we're just going to go off of what the pulse ox reading or her oxygenation was, because there's a lot that goes around that as well. So you have to look at the whole big picture to see, and then you make your decisions based off of that.
Yeah, I also know that they've been misinforming me. Not yet. That the nurses have been misinforming me regarding and the doctor regarding what medication she was what drugs they had her on.
I would need like some specifics and stuff to look at to see for sure what was going on, what was happening.
I was getting inconsistent information for some reason, and they were telling me she was just taking Ativan. But then they would tell me, that she's taking something else, and it just doesn't make sense why they keep telling me, oh yeah, she's only on Ativan, and then but then they say she's on morphine and Precedex too, and then one of them said she's only on Precedex, someone said she was only on Ativan, and I found out that she's on all three after a whole week. And then still after that, when I asked about it, they chose to not disclose that information. When I asked what drug she was taking, they said only Precedex. And I already know they were giving her morphine and Ativan at that point.
Again, it's kind of like you need some specifics to be able to look at things, because maybe one nurse is looking like, oh, she's on Precedex, I haven't had to give her anything else today, so they're thinking, oh, that's all I have her on. Not realizing maybe you meant I shouldn't be given anything in the last 24 hours, and maybe the shift before had to give her something else.
I asked what drugs she was on. I didn't ask what she gave her,
But they might be thinking, what is she on right now, as they're taking care of her.
Yeah, well, what is she? That's the same thing. What is she on right now?
But at that point, she could have only been on a Precedex strip. Maybe they haven't had to give her any Ativan.
No, she did afterwards verify when I brought it up. She did verify she is still on the morphine and the Precedex.
So it just because sometimes they're scheduled doses, sometimes they're PRN as needed doses.
There's two different answers, and it's inconsistent information. So it's really, I don't appreciate that,
That's understandable. So again, like I say, if you can get me a list of specifics and dates and times and things that have happened, then that makes it a little easier for me to try to investigate to see what had happened, and if you have like a date and time of was told whatever, and something that allows me to research it more and talk to my staff.
Yeah. So could you check on the occurrences that happened on check on the 18th, 19th? So I guess we're in 21st. Yeah, I would check on the 20th and the 21st because she should have been doing well on the 20th. And I think
right now I'll go
the first 3 days.
See how she's doing right now.
Yeah.
I'm going to give you an update.
I know the 18th, 19th, and 20th, they were letting her get up and go to the restroom and use the restroom, and her oxygen levels were getting better. And they told me after they were 90, they could take the oxygen mask off, and they got all the way up to 95, and they didn't do it for some reason.
Well, again, you'd have to know what were the oxygen settings you would need to know.
Yeah, well, they said it was maximum, and then they said they were going to lower them.
So you'd have to see if that was happening or not.
Yeah. Well, they didn't. That was when they said that they still wouldn't let her get up out of bed. They came back, and she needed to go to the bathroom. And her situation was at high oxygen levels, and then they started, telling her you can't get up to go to the bathroom and stuff, and forcefully sedating her, and it caused her oxygen levels to fluctuate.
Well, like I say, you have to look at the chart to see where the issues were when she was getting up. They started having her oxygen was dropping as she was getting up and exerting herself, because typically that is. And
that was Dr. Garber that was there that day?
Dr. Garber probably was on call, and I've been over a weekend or a night. She may have been on call then for Dr. Mulray.
And I spoke with him. He had made the decision without calling me first.
Well, some of this is the doctor caring, because if you are looking at trying to help a patient breathe better, like I say, unless a family has said do not do anything else, let them go, then it is also our duty to try to make sure that we're taking care of them the best that we can.
So she should have been allowed to go to the bathroom. Right.
Well, if you're having issues with desaturating, or the nurse feels it's unsafe to allow them to get up, like I say, we've got to make sure our patients stay safe. And if there's concerns about her oxygen dropping by getting up and going to an unsafe level, or if there is concern
but it shouldn't be, because the first day it was lower and it was getting better.
Again, you have to look at the settings to be able to speak to that.
Well, I know
and if there's
when they
concerns
admitted
about
her, they put her
if there's
on maximum right away.
But there's concerns about her falling too. Then no, you don't want a patient to fall. You know, if somebody's weak and falls and they could, hurt themselves, like we don't want that to happen either.
Yeah, that wasn't our concern though. If I would have been there, I could have, to be for her walking, but we couldn't.
Still a hospital concern.
Yeah, but
I understand you
just
might
like you
say
said
it's not a
before,
concern,
though, right?
But
like,
it's still a hospital concern that if somebody's gonna get up and fall and injure themselves while they're here under our care, like, we don't want that to happen to anybody.
Right. You did.
Sometimes you can make things worse than they fall. People, fall and they can break a bone, they can get a bleed in their head, something like that, and then you have two issues that you're trying to deal with.
Right. You did say they weren't supposed to change things. That is the federal law that they're not supposed to change things without consent of either person. If it's not something that's a life-threatening concern, and using the bathroom wasn't a life-threatening concern.
If you fall and hit your head, it can be a life-threatening concern.
If it was, then you guys were allowing her to do it for 3 days already.
But people can change. She could have come in and been fine, but as she was here and as she progressed, it became, more like, okay, she's weak, she can't get up, she's requiring oxygen, she's desaturating. So how somebody presents on admission.
So she should have been, provided great, she has the right to a good enough care, and that's why I wanted her transferred, and they weren't getting it done.
But I think still providing a way for her to use the restroom.
Yeah.
Well, I mean, ideally, yes, using a bedpan is not the most ideal thing in the world.
Yeah.
No, but if it's what you need to do to be safe, then it's what you got to do to be safe.
They weren't supposed to change it without.
I've been a patient too in hospitals and had to.
It's the same type of thing though. They should have presented me with the option. They should have presented her with the options if she was capable of making decisions, and if not, it was supposed to be directed to me.
Okay, but if you're going in to use a restroom and say, I don't think it's safe for you to use a commode with her, then how do you know that conversation didn't occur and she didn't agree to it?
Because she didn't. I spoke with her on her cell phone right after it happened.
I think it's tough because there's things that we're going to get both sides, and it's hard to know unless somebody who was actually there has something to say exactly sure what happened.
I have Verizon phone records.
Well, I understand you have records of when calls occurred, but to know exactly what was said or what occurred in conversations between the nurse and your mom as things were happening.
Most of those are on video, and
well, there's nothing should be videoed because you can't video unless you're telling somebody just the same.
Well, in my own household, I can.
You cannot record. You can't record or video somebody unless they're aware of it. If you're calling into your mom who's FaceTime and they know it's on, then they got to know. If you come here and you're talking to a staff member, you're talking to me, and you're recording our conversation, and I don't know, that is illegal as well.
What law is that?
Free speech, privacy. You can't. It's privacy. You can't just record somebody without them knowing.
People are allowed to walk down the street and live stream all they want to.
Okay, that's a little different than engaging somebody in a conversation.
Well,
if you engage somebody in a conversation where you're directing specific questions at them and asking responses,
I'm documenting myself is what I was doing in my situation. It has nothing to do with anything else, who I was talking to. It has to do with my situation. It's documentation of my own autobiographical purposes.
Then you've got to let people be aware that you are documenting that for a specific reason so they know. But you cannot be recording nurses trying to do their job or doing things. You can't record them having medical record charts open, because if you're recording something, they open to a chart that's not your mom's because they're trying to do some work and not knowing you're recording. If something gets out, that's a violation of the person's HIPAA rights. So you can't just really. It's a little different if you're walking down the street taking a selfie video as you're talking. People are walking past and stuff. That's a lot different than somebody doing something purposefully and they're doing something not knowing you're unwillingly recording them and they aren't aware of that. Like if you're recording this conversation that we're having, that would not be right because you told me you weren't recording it, right? Right?
I'm not aware of anything like that being illegal.
Well, but what about the fact that at the beginning of this I asked you, are you recording this? And you said no, and then you were to record it, would that not be right? If somebody asked something, a point blank question about you, if you're recording something and you say no, but you are recording it, you wouldn't think there's something wrong with that?
Well, yeah, there's something wrong with it, but I don't think it's illegal though.
Well, because then the other option you run into is then just people aren't going to want to.
Yeah.
It's going to be hard for people to trust to give you information, and we want you to be informed, we want you to know what's going on, but. Because then you could snip and cut things to make it look like people are saying things that they're really not saying. You could edit and string something and say, "Oh my gosh, they said this to me," when that's not what was said at all. But you snipped and cut answers together to fit what you want the answer to be or what you want it to sound like. Does that make sense to you? Like if I were to have a full conversation with you and ask you questions, I could go home and I could edit it and I could make it sound like something totally different that you said because I edited it. Would that be fair to you?
No.
So that's why you see things happening, and it'll tell people, when you see, the lawyer shows like Law and Order on TV, they say we're recording this conversation when the tape's already started, so that then everybody can say they're aware it's being recorded.
Yeah.
Yes.
Okay, well, I'll go check in your mom and I'll come down and give you an update, okay?
Yeah. I would just appreciate if you could just explain her situation better to me, because I don't feel like the doctor's doing a very good job. I really don't. And then they said it's not like the situation's getting worse right now. And I don't understand why it's getting worse when she was improving. Before I even brought her into the emergency room, her temperature was already normal again, because she had a fever a few days before that.
Well, I've heard there's been some. Has there been some medications that you have not wanted her given?
I didn't give him permission for any of those medications.
Okay, but if she comes in with an infection or something going on, and there also is medications that we would like to give her, doctors may